Well, good morning, everybody, and welcome to another edition of Real Health Talk. We're going to talk about your health, and I want to talk today about disease creep. Disease creep. What is it? Did you know that disease creep is an actual condition? It's actually something that's defined medically. Disease creep. Right, so disease creeping in on you. And I'll start this out by saying the best way to cause a disease is to treat for it before you have it. Does that make sense? That's what disease creep is. And there's a medical definition for disease creep. And part of this is because Big Pharma needs your money to keep their levels of cash flow and all that stuff. And treating and curing disease, there's really no money in that. So Big Pharma wants to get you sick, get you hooked on drugs early, and keep you on drugs until you're programmed death, literally. And it's not that your medical doctor is evil and that's his evil plan and he's going like, whoa. That's not it at all. But he also knows that you will keep coming back if you can only get from him what you can't get anywhere else. And that's that valuable prescription. And I learned a long time ago in medical studies that I was actually taught that if you have a child come into your clinic and you do not give them a prescription of some kind, they will not come back. So the perceived value is mommy brings her kid, you say, oh, well, antibiotic, that should knock it out. An antibiotic, you can nurse your cold for a week and get over it. Or if you take an antibiotic, it might be gone in 7 days. So you just got to pick your poison here. But there's a medical term called disease creep, and disease creep happens when a patient with these preconditions, these predispositions, gets treated for the disease before the disease actually shows up, and it helps bring the disease in. Like cancer, you start treating for cancer before it happens, and you just keep treating for it until it shows up, and then it's like, well, see, there, a good thing we got on that early. Or hypertension. I'm going to give you some really good examples of some of these at the end of this little 15-20 minute talk. So hypertension, pre-diabetes, treat for that. Pre-heart disease, right? So they give you the cholesterol med, and you just have a mild hint of the case, so they start treating for it, and then it grows into a full-grown case. So pharmaceutically, one drug leads to another. One medical procedure leads to another, and then pretty soon it's two more, and then it's three more. And some of these people that used to come to my clinic would come in, and they'd have 15, 20 meds. And I would look at these medications, and I'm going like, who did this to you, and why? So I even had a medical doctor, head of surgery department, brought his wife to me because she was on 15 meds, and he said, this is not sustainable, it's killing her. And I got her off of all of them. And I won him over to natural medicine. It was pretty cool. So the sooner they get you on drugs, the bigger, the sooner, the greater their profits are going to multiply in Big Pharma. And unfortunately, they're really not on your side. They're on the profit side. Their duty is to provide profits for their shareholders. And disease is a spectrum, technically. So you've got your good health. Let's say you're in your 20s, top of your game. It's like, I can whip the world. I'm just on, everything is great. It's all roses and marmalade or whatever. And then through the years, it's like this disease creep comes in, right? And little by little, you're kind of falling down, floating, like the leaf in the fall in the Snoopy and the Snoopy film. And then all of a sudden, here's where disease shows up. Oh, you got pre-hypertension. Well, health is a spectrum. What was up here was perfect health. What's here is, oh, you got pre-hypertension. Oh, you got cancer. But disease is a spectrum, right? You already had the predispositions way up here. You already have the predispositions for cancer way up here, and the precipitating factors all through your life help to bring that in. And it's a disease creep. So the sooner they start treating you for the disease, the sooner you're going to get the disease. And let me tell you something else, that big pharma drugs have side effects. Some of them good, some of them bad, but don't mistake this. They are all side effects, right? Drugs cause side effects. Some of the side effect is, well, it lowers your blood pressure. Why is your blood pressure up? Maybe your arteries are starting to constrict and your brain's trying to get enough blood flow, so your body ups the pressure, but we need to lower that pressure. So you're going to have a stroke. So they lower your pressure and your brain's going like, but I needed that. And we cause the disease creep, and then they up your medication more because your body says, no, I need it. I got to constrict. We need high blood pressure to survive. Instead of finding the cause of your high blood pressure, the constriction in the blood vessels because of what you're eating or because of the chemicals in your water or whatever's going on, you got to find the cause, or you're going to end up like this. Did you know there's side effects to a healthy diet? The side effects are health. That's a side effect. And technically, they're all effects. Everything is an effect. The drugs have effects, not side effects. They are all effects. So that's my point there. And did you know also that chemo causes cancer? Chemotherapy causes cancer. Oh, you think you whip this one right here, but watch out later. Survival rate for this kind of cancer is 2 years. So if we get you to live 2 years and 1 month, no matter what the quality of your life is, then we've succeeded. We've cured your cancer. Hell, get me started. Prostate treatments. The best way to get prostate cancer is to treat for it. Start it early. You got to get your prostate exam. You got to get your PSA counts. Well, PSAs are transient. They go up and down. And they just happen to catch you with a high PSA and they, whoa, got to get you on some androgen blockers or something like that. And they start treating for the disease, and then you've got the disease. Why is your prostate inflamed? That's what I want to know. Let's deal with that. And diabetes meds, they cause diabetes. And they attack the pancreas. They cause pancreatitis. These are effects of the drugs. Pre-hypertension meds, they keep lowering the numbers. So, now you're 130, you're pre-hypertension. We got to get on top of that. Right? Your cholesterol is 195. Oh my gosh. Cholesterol meds have not lowered heart events in America yet. They've only caused other effects. And it's disease creep. So they can treat other diseases. Antibiotics cause stronger infections, right? Antibiotics, anti-life. Bio is life. Antibiotics. Probiotics, pro-life. Brings a healthy immune system, brings a healthy gut. It brings health. It's pro-life. Don't do the antibiotics, especially when there's no need to. Antibiotics don't treat a virus. In fact, antibiotics are kind of ineffectual for treating bacteria, as we see. The more you treat with antibiotics, the worse the infections become. And I've had an example of this. I've had literally dozens of people come to me in my clinic, patients, they come and they would have these infections. They would be in the hospital with their leg rotting off. And I've actually had several nurses that would come to me and say, what do I do for this? It's the flesh-eating bacteria. I said, well, get you a spray bottle of hydrogen peroxide and dust it. Just dust that wound several times a day, and within 3 or 4 days, the infection's gone. But they were treating it with antibiotics, and they were debriding the wound, and they were just all kinds of painful procedures, and the patient is in a programmed death spiral. When what they needed was hydrogen peroxide to treat the staphylococcus, whatever is attacking them. So, disease creep. The sooner you treat for a disease, the sooner you'll get it, the sooner you're on the big pharma roll payroll. You're paying them, and they will get your very last dollar. And I want to give you some examples of some real cases, real recent cases that I've handled where the disease creep was working. One of them was a breast cancer, real recently. And she got to her third round of chemotherapy and her whole system collapsed. Now, they'd already done the lumpectomies. And they said, now we're going to do preventative treatment for your cancer. And this is a nurse, by the way. So the third round of chemo, she's supposed to do 8. Third round, she collapsed. She was gone, and even worse than that, her thyroid hypertrophied. It got really big. So they said, we got to cut that out. We're going to have to take half your thyroid out. It's twice too big. And they scheduled her for 30 days, and her husband said, no, let's do what Craig said. Craig said, try some Terry Natural Thyroid Care Plus, which is just a brand name that really worked well for her. He said, if it doesn't work in 30 days, when you go back for the procedure, then done and done. They went back, and guess what? Her thyroid was normal. They would have treated her for what they caused, and now she would have been forever on thyroid meds, right? And her cancer thrives in a low thyroid condition, and the reason the thyroid hypertrophied is because it wasn't getting enough iodine, and so it got bigger to try to collect more. And you see the problem here, people? I've got another very recent prostate. The guy's in his 80s, and they want to do the ream job. They want to go inside and they want to hollow everything out and make more room so he can urinate, right? And then they want to put him on an androgen blocker, and they said within a few years we're going to have to take the prostate out, if not sooner. And so I'm visiting with the guy and his wife and the daughter, and I'm looking at his kitchen and what he eats and the things he eats and how he eats them and why and when and where. And I'm like, dude, gluten is causing your prostate to become inflamed, which is causing this whole problem. And the ice cream you eat, oh my gosh, read the label. Went in his freezer, I pulled out his favorite ice cream, and it had so much crap in it. It was horrible. I said, if you're going to poison yourself, at least find a decent ice cream and then just take 1 scoop. You don't have to have 5 scoops. He would eat it every evening. And he loved his pastas. I said, well, we'll switch you to rice pasta. Well, guess what? Within 2 weeks, he could pee again because the prostate swelling was going down. And he didn't need the androgen blocker, and they didn't have to cut his prostate out yet. Treat for prostate cancer, you're going to get it. In his case, there was a seizure kid brought to me not too long ago. She was having petit mal seizures, and the parents were really freaking out, which I understand. I had a child who started having seizures after her MMR vaccine, but she was having grand mal, so these people were really freaking out. They wanted to put her on seizure meds, which, by the way, one of the effects of seizure meds is to cause seizures. It's right there on the label. Warning, causes seizures, causes death. You want to put your child on this? She had a fungus. I put her on grapefruit seed extract and caprylic acid, and before the week was out, the petit mal seizures were gone. This agoraphobic little girl who wouldn't leave her room was out with her 12-year-old friends or whatever in the neighborhood. Because I called to follow up. I said, oh, she's out playing. She's fine. Wow. They were going to treat her for a disease with something that caused the disease. Another recent one I'm working with is a depression kid. So sad. And she sleeps for 18 hours a day. And she doesn't want to come out of her room. And this, that, and they think she's depressed. And now they want to put her on a combination of antidepressants, not just one, but a combination of 2 antidepressants to bring her out of her funk. And I'm talking with Dad, and I said, well, go get you some iodine from Walmart, paint the kid up with iodine, tell me how long it lasts. And he sent me a text and said, it was gone in 5 minutes. She's so iodine deficient. Her thyroid is so in the tank. She's 90 pounds overweight. She's 12 years old. Oh my gosh, and they want to put her on antidepressants and causes disease creep. Well, in the next few weeks, we're going to have some really wonderful success because we're going to get her to where that iodine lasts for 18 to 24 hours like it should. When the body's starving for iodine, it sucks it down. And the more you paint on, I've had breast cancer patients. I said, well, go home and paint your breasts. And they will text or call or email and say, but it's not staining my breasts. Well, the breasts are so hungry for iodine. They consume so much iodine in the first place that it won't even stain. This iodine, have you ever used it? Have you seen it? They paint you up before surgery because it helps protect the cells. It helps kill bacteria. It helps, cells get healthy with iodine, with the right amount of iodine. And the skin's a gateway. If you don't need the iodine, it won't absorb it. Hence the 18, 24 hours, the stain is still there. Simple test. And it alerted them. And the father said, but her thyroid panels came back and said she was fine. The doctor said she's got a great thyroid. Well, they tested the blood. But that's not where thyroid works. That's a transport. That's the highway for the thyroid hormones. It wasn't working in her gut. It wasn't working in her brain. It would not work in the cells of her body. It could not transport in there. She was iodine deficient, and there's some other cofactors that work to help get iodine to work. That's her problem. Otherwise, she's going to have disease creep, and she'll be forever hooked on big pharma for however long she lives. And of course, treat her with an antidepressant. Now the odds of suicide go up. The odds of dying early, they go up. The death by all cause goes up when you're using pharmaceuticals and when you're using antidepressants. One of my very good friends, his mother, I think she was in her 80s, and she's pre-diabetes, she's gonna have diabetes, or we got to put her on glucophage, it's like I didn't even meet the lady yet. My friend's telling me about his mom, and I said, well, what's her favorite thing to eat? And he said, potatoes. She eats 6 or 8 potatoes a day, and not little ones, big ones that, the starch, all that starch is easily converted into sugar. Her body's craving it, but it's causing her pre-diabetes. She quit eating potatoes, and her pre-diabetes went away within days. Disease creep. If they'd have treated her with a glucophage, they would have had her on an insulin pump before long, because that's what they do. One of the men in my men's Bible study, his blood pressure was 170 over like 105. Horrible. And he was on 2 different meds to lower his blood pressure. And I said, well, when did they put you on that? Well, my blood pressure was like 140, 143. And they said, oh my gosh, you're getting high blood pressure. We got to treat for this. I had him drink 1 glass of hibiscus tea a day with some little bergamot oil, cooked in with it and steeped. You bring the water up to boiling, you throw the hibiscus flowers in, you put about 8 drops of bergamot oil, and then he sweetens it to taste. And within a week, he was off his meds. And I didn't recommend him to get off his meds. He got off his meds. Within a week, he was down to 150. Within 2 or 3 weeks, he was down to 130. And today, he's down to about 118. This guy's in his 70s. And he has the blood pressure of a teenager. But they were causing the disease creep. They treated him, and they've lowered the number. They lowered the number, then they lowered it. Now, it used to be 150 was pre-hypertension. Now it's 130. Why is your blood pressure high? Find the cause and treat it. Last case I want to talk about is another breast cancer case that came to me about 2 years ago. And this lady was pregnant. And she was like 5.5 months pregnant, and her husband came, and they said they want to abort this baby. They want to cut off my left breast. They want to cut off my right breast, just for preventative. And they want to put me on chemo and targeted radiation and they want to start Monday. And this was Friday. I said, well, what do you want to do? She said, well, I want to have this baby. And furthermore, she said, I want to breastfeed this baby. And I said, well, why not? Why not? And when I looked inside of her mouth, the the second to the last teeth on the top both had mercury amalgam fillings, and that's the breast cancer meridians. And any good naturopath knows this. Homeopathy people know this. The Oriental medicine people know this, but the medical doctors do not know this because it's disease creep. You've got to get those mercury amalgams out of those teeth. And not only that, well, no, she didn't have them on both sides. She only had them on the left side. And guess which breast was affected? She had that baby, and she nursed that baby, breastfed that baby, and she still had breast cancer. And then when she got through, that's when she got through nursing the baby, then we can get more aggressive if you want. If it's still there, if it's growing. So disease creep, people. Stay away from it. Don't do drugs. Don't do drugs. Now, drugs can save your life in an emergency. Don't get me wrong. They will save your life. They can save your life. And in fact, don't go to your chiropractor if you've just been in a car accident and you're bleeding to death. Don't go to your yoga instructor if you've just fallen off a ladder and broken your neck. So you go to the ER, they get you alive long enough to see someone like me. Okay, and then attack the causes and stay away from disease creep. So that's my message. I went a little long, but I get excited about this stuff. I'm passionate about it. I'm drug free. I will be drug free. I will die before I take drugs, unless I get in a car accident or something traumatic and they can save my life, but then I'm going to attack it. I'm going to attack it from a health point of view. So God bless you guys. I wish all the best for every one of you. Seek the answers. Seek the right answers. See you next time.